Hey, welcome back to Whitebelt Mobility. We are going to work on some soft tissues on the back of the leg, otherwise known as the posterior chain. And so think about these tissues as your butt, right? The muscles and soft tissues in your butt, and on the back of the thigh or the hamstring area. And we're going to spend about 2.5 minutes on both legs, kind of working through some of those soft tissues. Now, we might do this after a day where we would deadlift or kettlebell swing, or maybe even do some Romanian deadlifts where that back of the leg is really working hard. And most of us do not do a lot of soft tissue work to help us feel better after the fact. So this is going to give you a strategy on how to feel better post activity. So all you need is a roller and something that you can sit on, coffee table, chair, etc. But you're going to want that leg to be able to dangle off of the edge. Okay, so going to put the roller on the table or the box, and all I'm going to do is sit on this. I'm going to try to keep this roller on my butt for now. We're going to work down towards the knee as we move forward, but ideally I'm just going to kind of work as much pressure as I can handle, and I'm just going to get comfortable here. And quite frankly, if you've never done any soft tissue work like this, these things can be quite uncomfortable. You might think, wow, this is really painful. And that is an indication that you need to do this more often, to be honest with you. So we're just sort of scrubbing back and forth. We're still on the big muscles in the butt right now, the glute muscle. We're going to slide down towards the hamstring in just a second. We're going to take our time doing this. Minimum effective dose for soft tissue work or any kind of mobilization that you're going to do is 2 minutes per side. That's minimum effective dose. And I'll go ahead and sort of let you in on how the sausage is made. We're going to slide the roller down a little bit. So it's now on the hamstring. Most people get on this soft tissue and they will spend 20, 30 seconds max on it, and they'll be so uncomfortable that they get off of it. They stop doing the mobilization. And quite frankly, that's not enough. It's not good enough to actually elicit change and make yourself feel better. So you're just going to have to get used to that discomfort for a period of time. I will tell you, the more you do this, the more comfortable you get with that compression on those tissues, and it starts to feel quite good. Like right now, I have it feels like an itch on the back of my leg, and it feels quite good. It's just blood flow getting into the area. And after I feel that spot is taken care of, I'm going to slide down just a little bit more. And the lower I get on this hamstring, the more I can almost fold over and get a lot of body weight pressure onto that tissue, and it feels quite good. And even once I get to the point where I don't want to move around anymore, I can even move my leg, sort of straighten that knee. You can kind of rotate, kind of play around as much as I can. There's no real right or wrong way here, as long as you're taking some big deep breaths and controlling your breathing. Another thing that we find is for people that have less tolerance to this compression, they hold their breath. So I'll finish that in a second. Let's switch sides. We'll go to the other glute, the other butt muscle. So I'm just going to kind of sit and scrub. What they do is they hold their breath, right? It gets very uncomfortable and they hold their breath and they go, right? And that is another indication that we're probably not very tolerant to the level of compression that we're doing, and that's probably not doing us a lot of good. So what we would do, what we would advise our athletes to do, is to back off of that compression, maybe not press so hard into those tissues, and take some deep breaths. So the goal is I should be able to manage my breathing. Big, controlled, slow, deep breaths. Good. Let's move that down to the hamstring a little bit, just where my thigh meets my butt. Sort of gluteal fold is what they call that. And again, I'm just going to kind of move side to side. Kind of move side to side here. My box is making noises, so I apologize for that. Again, if you want to have some overpressure, you can use your hand, kind of push down on that leg. Again, it feels quite good for me, which means I'm not overly sensitive in those tissues. I can handle a fair amount of compression here. I'm even getting a little body weight compression as I lean over, I can get that leg extended a little bit. You can even work inside and outside of the thigh. So let's say your inside of your thigh are really, really aggressive, is really tender, really sensitive. I could even roll onto the inside of that thigh with the roller and then move around. And for a lot of people, me included, that becomes very gruesome tissue to work on. It's really, really difficult to get through that, and I have to be very diligent with my breathing and the level of compression so I can get through that. So coming up on a couple of minutes here. Good. So that is a very quick, easy posterior chain mobilization that you can do almost every night while you're watching TV in the living room. Make yourself feel better. Soft tissue work, particularly at the end of the night, and you'll feel better moving forward for the next day. We'll see you next time.